keep trying to. Oh boy.
All right. Well, I think everybody's here. So I'd like to welcome everyone to today's webinar, One Test, Two Tests, Old Tests, New Tests, Essential Diagnostics for Senior Dogs and Understanding Why Your Vet Recommends Testing, hosted by Gray Muzzle Organization. So let me tell you a little bit about Gray Muzzle, myself, and then our presenter. So at Gray Muzzle Organization, we envision a world where every senior dog thrives and no old dog dies alone and afraid. We're not a rescue or a shelter, but a 501c3 organization that provides grant funding to rescues and shelters specifically for senior dog programs. In 2024, we funded 100 shelters and awarded over $1 million in grants to provide dental care and diagnostic testing, to fund seniors for senior adoptions, for hospice care, and to keep senior dogs in homes that they already have by providing funds for them to get medication or care they need. And we're very grateful for and dependent on the kindness of our donors to help senior dogs nationwide and beyond. So I'm Barbara Giannini. I'm new to the GMO board of directors. And I'll be corralling the questions, so please send them in, but we'll wait until the end for Q&A. So a little bit about myself. I have two senior dogs, a 9-year-old white husky cattle dog mix and a 16-year-old Shih Tzu. I call myself a reformed financial executive because I spent about 20 years in finance, but now I enjoy writing stories, many of them rescue dog themed. So today we are lucky enough to have Dr. Ashley Ackley present about this webinar. Ashley is one of our board members and we're very lucky to have her. So I'll let Ashley tell you a little more about herself. Ashley?
Awesome. Thanks, Barbara. We're really happy to have you on the board. And like she said, this is about essential diagnostics for senior dogs and understanding why your vet recommends testing. And this may be disappointing to some, but this is part one of part two. And so part two will be sometime in the future. I just felt like there's so much information that is important about this topic. And I just kept finding more and more things that just kept kind of piquing my interest. So hopefully it piques yours too. But some of the questions that I think you have are probably going to be in part two as well. So hopefully you'll join us for both. But yeah, as Barbara said, we're both on the board of directors of Gray Muzzle Organization. So happy to be here and happy to support senior dogs across the nation. And I just think it's wonderful that you all are here. You're also supporting senior dogs here now, and I'm guessing in your communities at home as well. So thank you for joining us. We just appreciate your support so much, as do the senior dogs, because our vision is a world where every senior dog thrives and no old dog dies alone and afraid. So with that, I am going to say a few things that I am and a few things that I am not as I went through this presentation. So I am a small animal vet in Denver, Colorado. I've kind of done everything from shelter to ER to general practice, and I currently do relief in all of those capacities. My husband and I have two senior dogs. Currently, we have Tilly Terrier and then Dollar. We call him Dollar Bill. Came with that name. And I just have a thing about changing names. So it is Dollar, our hospice lab that we've had for 3 years. And we're so grateful for that time with him. And then we have a very sheltered, special squish face, toothless cat named Dwight. He definitely needed a veterinarian to own him because he's a disaster medically, but he's great and he loves our animals too. So, and again, I'm on the board of directors of Gray Muzzle because I absolutely love senior dogs. I will see senior dogs all day long over a puppy any day. They're just the best. So I'm also a lover of travel. I love to volunteer when I'm traveling. So I do a lot of vet spay neuter trips across the world. I like to bike and I like to listen to live music. So some things that I am not a diagnostician in the sense of that's all I do. I'm not a pathologist. I'm not a geneticist or an oncologist. I'm not a mathematician or a statistician, as I found out. It kind of brought back some nightmares from undergrad going through this too. But basically, the more I dug into the subject, it just opened more and more cans of worms and more information. And so I hope that I tried to pare this down a little bit and answer your questions as best possible. But there are some questions that I know I won't be able to answer because I don't remember how to do math these days. So I think we always want a black and white answer, or yes and no, or do and don't, and we rarely get that in veterinary medicine. And it frustrates me I know it probably frustrates you as an owner a lot of times, but it is complicated. And so hopefully this helps kind of piece out some of that for you. I'm not computer savvy at all, despite being an elder millennial, as I guess I found out I am. But I apologize if things are blurry or, um, this is boring. I think you'll see a lot of information about my own animals as we go through this too, because I didn't know what I was allowed to use from the internet. So I just want to apologize in advance if things don't work the way that they should. I am impressed. I even print my notes because that's where I'm at. But I'm impressed that I made it this far. But I think hopefully you enjoy this. So some other things, I'm really passionate about the human animal bond and client communication and education. I think that it's so important, and especially in the time frame that we often have with one another as a veterinarian and a client or a pet parent, we don't always have the time to explain everything that we need to. And so it's something that is it's just really important to me that people understand their options. And so I'm really passionate about that. I'm also really passionate about I love this model that we're starting to see more in vet med called the spectrum of care. I think it really speaks to where a lot of people are at, where a lot of owners are at, where a lot of veterinarians are at. And so it's kind of taking all of these different pieces of basically what is your animal's quality of life and how do we get there and how do we make decisions, and there's a lot that goes into that. And I want everybody to feel especially my clients when I'm working with them, I want them to feel like they know the information, they have the options, and then they make the decision that's what they think is best for their pet and their family. And I support that. I rarely feel like I have a case where um, I am really on a different page than an owner in terms of quality of life or what I think needs to happen and what they think needs to happen. I think usually it's about trying to come together and make decisions together because you know your pet best and you know your family best and you know how you want to go forth with some of this testing. So um, I'm not endorsed by any company or resource I list here, so I want to put that out, especially as we talk about some of the very specific tests, um, which will probably again be more in part two. And then the other thing I wanted to make clear is that I'm not your vet. I think there are so many different options, and there's not necessarily a right or wrong. And so these are just really personal decisions. And I hope you have a vet that you trust and that knows your animal and that knows you, because so many factors go into these decisions: prognosis, quality of life, personal beliefs, all of finances, all of that goes into making those decisions. So I hope that you have a person that you trust, help you work through seeing your dog stuff and some of this testing stuff. So um, with that, I wanted to just put a list. I think I asked my veterinary friends, what questions do you hear when we're trying to do diagnostics on animals? And I think all of these are things that we have pretty much all heard in the veterinary space. And so I really wanted to try to simplify why veterinarians make recommendations, and again, the options behind it. So this topic is extensive, and like I said, there'll be a part two. So I think, with advances in veterinary medicine and so many different options, kind of understanding the basics of what tests can and can't tell us, hopefully it allows for better care and options for our senior pets. And this is a plug for pet insurance. Again, I don't have any companies that I recommend or anything like that, but if it's something where you think it might be something you want to look into, I do recommend it, especially in younger animals, when you can sometimes get in and it can be a little more cost effective, but having that throughout a pet's life. Again, personal decisions, but I have seen it help a lot of animals that maybe owners wouldn't have gone as far if they didn't have pet insurance. And a personal example is our little terrier just had an MRI, and I don't know if I would have done it if I didn't have pet insurance for her, because we weren't sure what exactly was going on, and so that's a pretty costly diagnostic that her insurance did cover. So lots of options out there for you. So these are some common questions. Oh, let me go back. I'm sorry. The animal prognosis predictor, this used to sit on our desk at the ER, and it's kind of a joke, but I think we deal with this a lot where we want concrete answers and we aren't always going to get them. Even for ourselves as veterinarians, we want a concrete answer. And sometimes we don't always have that luxury either. And so it's a little joke, but it's something that I think is really pertinent and something we both deal with as an owner and as a veterinarian. So, and same thing, these are some questions that vets sometimes want to ask you. It's hard to figure out what people want and where they would go with their animal in a really short period of time, like in an appointment. And it's really hard to know. I wish it was easier. I wish it was more straightforward and black and white, and or there was only one path. And that's really not the case in veterinary medicine, even more so than in human medicine, because unfortunately, owners are responsible for that financial care. And so decision making can be really, really hard. So again, I put this up as a joke. I think it's kind of blurry, but it says the fix it pill, the what's going to happen crystal ball, magic wand, the x-ray glasses, because we hear this a lot too, where it's like, okay, what is wrong? And we're like, oh gosh, we need to do these next steps to figure it out. So again, just some things that we kind of think about too. So, and I think again, it all goes back to this spectrum of care, which I think will continue to be a bigger and bigger topic in veterinary medicine as we go. Um, so what does a healthy senior dog look like? We see this a lot. And then what is wrong with my senior dog? I would say the majority of the time, when owners come in for their annual exam, they're like, "Oh, my dog is great. They're doing fine. They're just getting a little bit slower. They might have some weight loss. Maybe their appetite's down a little bit." And so sometimes it's gosh, everything seems okay. Sometimes they do come in when they're sick, and that's a little bit different. But sometimes as veterinarians, we find things on exam that maybe owners didn't recognize. It's like if you live with someone, you see them every day, you don't realize, oh gosh, they are losing weight, or oh gosh, that has changed. And sometimes we need further diagnostics. So sometimes we need blood work or x-rays, and the list kind of goes on and on and on from there. Also, sometimes things can change really, really quickly. You can have totally normal lab work, and the next year it's very different. You can have kidney disease or liver disease, and that can change even within a month, sometimes even within a day. Some of these lymphoma cases that we see, blood work can be totally normal and then it can change pretty quickly. That's an uncommon thing, but it can happen how fast. Like I'm shocked sometimes at how fast things can happen. I think the other thing we struggle with sometimes is, okay, well, we did that. Why can't you find what's wrong? These tests have been expensive when we can't figure it out. Um, and so again, that's a challenging thing, because the number of tests, I always kind of joke, gosh, if it was a human, your dog would have had 6 MRIs, 5 CTs, 3 ultrasounds. Sometimes it can be really tricky to find out what's wrong. I kind of liken that to Dr. House, if anybody's seen that show, where he gets these very complicated medical cases. And even in human medicine, sometimes we don't have answers, and it's really hard to figure out. I'm experiencing that with my own the little terrier Tilly. We have done a lot of testing and we still don't know what's wrong with her. And that's frustrating for me as an owner and as a veterinarian. So Blood work may or may not tell us what's going on, but it's a great place to start. Um, and so I think that again, it's just things that we hear when we're talking about senior dog care. And then these are all of our senior labs. We like to adopt senior labs these days, and we like to adopt shelter medical shelter kitties, and there's lots of cuddling that goes on in our house. So these are just some of my favorite pictures of that. So just some info and resources. So senior dog preventative care, where are we going with this? So I feel like just in general, veterinary care has moved from the reactive approach of, oh gosh, my animal's sick. And now what do we do, to the proactive approach? Are there things that we can find that maybe we could do something about? Um, and so that's definitely become more of a shift. I feel like it used to be, oh, yep, you go in yearly, you get your shot, and you're good. And that's preventative care. And now we're seeing more and more that, gosh, some of the testing is actually maybe even more important than certain vaccines for your senior dog. So AHA does have some guidelines. So that's the American Animal Hospital Association. Again, I don't endorse them or anything like that, but they make some guidelines for senior dogs. And then another resource that I do like is veterinarypartner.com. And this website, keep pointing like you guys can see that, and you can't. The lab values for dogs and cats, I think, is a really helpful article, but they have a lot of other information about preventative care and just really any topic you could think of. So one thing that I do think we are also changing to is recommending that we see our senior dog every 6 months. Again, things can change so quickly. And sometimes it's something you may notice, and sometimes it's something you may not notice. So we're looking at weight, we're listening to your dog's heart, we're looking at dental disease, which actually, again, more of a preventative care thing these days. Can we do maybe more dentals and cleanings when your dog is younger versus as they get older? And then, oh gosh, they've never had a dental in their life and they're 15 and they need all of their teeth out, and actually now they have heart disease, and those two things can be linked. And so again, just more of those discussions. We're palpating, we're talking about arthritis, so it's a good time to really connect with your vet and discuss quality of life, and again, kind of what are your goals as an owner. um, so the hard part is, what does a senior animal look like? And there isn't any one specific definition of that. I do like the AHA guidelines that says to find seniors the last 25% of estimated lifespan through the end of life. As to what that means, well, you might not know how long your dog is supposed to live, or the breed is supposed to live, or anything like that. We know that smaller dogs and cats live longer than larger dogs usually, but that 7 years, 7 dog years, or 7 human years for 1 dog year doesn't really hold up. So these are just some references I found, but it's really, really sometimes a hard thing to say. So sometimes we'll say 7. Over here, I like this chart because it kind of on the right, it kind of lays out, your pet's age and body size, and how old they might be, where they might be considered a senior versus geriatric. But again, it's not a straightforward thing. And then also, like human medicine or humans, if you're overweight, if you have other diseases, poor nutrition, that can make you age faster. And so these are just some guidelines that we look at. So when you hear my vet recommends annual blood work for my dog, this is again becoming more and more common. And so questions that I hear, why would we want that if my dog is healthy? And what is senior blood work? What does that even mean? Or senior screen even mean? Um, Again, we're kind of switching from that reactive approach to that proactive approach. If we are looking at blood work, especially every year, especially in if we have trends that we can look at, it can be really, really helpful to know those things. So the other thing is sometimes we can catch things earlier, and maybe you don't do anything about it. maybe you choose not to, but maybe you just now you know. And so again, having those options, I think, is something that is helpful for a lot of owners, and it can give you at least an idea of things to be looking for too. So I think there's lots of debate in veterinary medicine around this because the yield can be really low. Sometimes we get blood work back and it's completely normal. And sometimes owners are like, well, why did I spend that money if it's totally normal? Everything's fine. Again, I think no, normal is great to know. I think that rules out a lot of things. And so that's a great conversation again to have with your vet. So uh, I do think there are sometimes smaller panels. So senior blood work sometimes can be expensive. And if you're interested, but maybe, cost is a factor, you can always talk to your vet and say, gosh, is there a smaller panel we could do that just kind of hits the highlights? Things like that. So again, having that relationship, I think, is really important. But I do recommend, or at least offer, annual blood work on every dog starting when they're younger. Um, because I think it's nice to know. And again, it also kind of gives a level of like, okay, my dog, the major things are okay. Some major things I'd be worried about are okay. So we'll talk about trends in a little bit as well. So um, this first off, I'll start by saying that the stock pictures of veterinary medicine always make me laugh because uh, on the bottom here with the stethoscope, he's listening to the shoulder, which you can't hear anything in the shoulder. I don't know where the I'm just always surprised that they don't actually use real veterinarians or um, at least know where the heart and the lungs are. So that makes me laugh. And then the shot with the little corgi on the right there. Yeah, we don't usually hold our needles like that or go like that to the animal, but again, I think it demonstrates good points about things. Oh, I don't know if you just heard my dog bark, but she's saying no needles. Same thing with the cat. Just kind of funny in terms of how they do these pictures. So, uh, in terms of what we are looking for when we do screening diagnostics, basically that's talking about, is there anything we can catch early? It's early detection. So it's part of some of the preventative care that we talk about. And it's the most common thing I think your vet will ask is, annual blood work or senior blood work. Sometimes we'll say senior screen. They're kind of all the same term. And the panels can be a little bit different in terms of what that includes for your vet. But most commonly, it's a CBC, or a complete blood cell count, and a chemistry. Um, and then oftentimes a urinalysis, or a UA, is included. So we get some urine from your dog. The other thing that's often included in that panel is a thyroid. Um, and so we'll talk a little bit more about that. So your dog could be acting completely normal, and we do some blood work and a urine sample, and find something that we need to talk about. We get so much information from doing senior dog blood work. So, and again, if cost is a factor, certainly talk to your vet about, gosh, what are options there too. So, other things we'll often see in a screening, and you've probably experienced this, the heartworm test. Very, very common, and something we usually do annually in most cases. Um, a pro-BNP. This is not a newer test, but it is a blood test that it's a heart marker. And so I see that being included more and more commonly in senior dog screenings, because if it's abnormal, that can tell you, oh gosh, something might be wrong with the heart. Now that gets tricky because there can be lots of false positives and negatives. And so again, the question then becomes, where do we go with that information? But I do think it's something that I see more and more commonly. I think the fecal, always an important thing in all dogs outside. Blood pressure. Blood pressure is also something that we often recommend in senior dogs, although that can be a challenging thing to get in some of them too. And then imaging. I have seen some practices include this in their senior screening. So sometimes we'll recommend imaging of the chest. And we're basically sometimes in those situations where we're kind of on a cancer hunt because cancer likes to go to the chest. It likes to go to the lungs. But it also lets us look at the heart and the lungs and just see if anything looks abnormal there too. So we'll get into some of this a little bit more. Um, so in terms of looking at screening studies, this is also hard because there aren't a lot of great studies out there on, okay, we screen these dogs and we found this, and then we knew exactly what to do with that. And so these are two different studies. One just came out and it was looking at 259 cats that they were considered mature adult and seniors, and they followed them for 2 years. And I do have the links later in the presentation. And again, this is where I went, oh my gosh, all the statistics. Oh gosh, I don't know. But basically, owners felt like their cat seemed healthy. They came in, they had a physical exam. We did blood, or they did blood and urine on them, and 21% of those cats were found to not be apparently healthy. Were not healthy after doing an exam and some screening. 12% of those were diagnosed with lab work, so primarily kidney and thyroid disease. And I don't want to. I know this is about senior dogs, but I do feel like cats definitely hide disease really, really well. And I know it's always stressful to bring your cat to the vet. I experience that every time I bring Dwight in. And so I know that's something that we always struggle with, that cost benefit, but there are a lot of things that can be done with kidney disease and thyroid disease in cats. This dog study wasn't as great. They took 100 senior dogs and they basically did the same thing. They had owners do a survey. They felt like they were healthy and they found some abnormalities. I just listed two of them here. One was an increased kidney enzyme. One was mild anemia. So 11 of those dogs had that. And then the question was, okay, what else is abnormal? What does that mean? And that's a whole other ball game there about, oh my goodness, what do we do with this increased creatinine in 30 dogs? Well, there are other values that we look at too, and that's why it gets hard to know. And then there's a range, so not super straightforward. I think there are three other studies that I think they were looking at health screenings in senior dogs, and none of them are great at this point because it is so dependent on what owners want to do and the severity of things. So we definitely struggle with that in vet med, but we still feel like it's helpful in a lot of ways. So getting into it. So again, senior blood work panel, usually we're talking a CBC, a chemistry, and often a urinalysis is included in that, although not always, but I think it's an important thing to think about. So when we get blood, the most common thing we're looking for the CBC chemistry part. And so they're basically both from blood. They're from different tubes. That's all we have to do is separate the blood into different tubes to get a CBC versus a chemistry. But this is probably where we get the most information about a pet when we're screening. And so you'll see us recommend pre-anesthetic blood work beforehand, and that usually is a CBC and a chem. So those things usually go together with blood work, or most commonly they do. There's a lot of values on the CBC. I don't know if you can see on the right. I look sometimes and go, oh my goodness, there's so much there. That's too much. But there are a few things that I'm really looking for that clue me in, and a few things that we mostly pay attention to. So I think they use the red blood cell RBC in humans. In animals, we often look at the hematocrit on its two values down on the right. We also call that the HCT, so sometimes you'll see that instead. And so that is basically the amount of red blood cells in your blood. And that's important because those blood cells carry oxygen. We need those to live. They also do a bunch of other things, but those are probably the most important things that we see. A PCV is a manual look at how many red blood cells are there, their values. And so we basically put it in a little tube and then we actually have to read that. Usually a CBC is done on a machine. So this little panel here was done on an automated machine. A machine calculates all that for us. So sometimes you'll see just a PCV, and that's something that I would do on my own. So very, very important. And that tells us a lot of information. Again, they can be increased or decreased. So when we say decrease, that means usually your dog is anemic. And again, lots of different reasons for that, but that's definitely a concern. That's what we're looking for. Does your dog have enough blood cells in its blood to carry oxygen and nutrients and all of that? So white blood cells. White blood cells are the infection fighting cells or inflammation cells. We'll see them go up for those two reasons. The other tricky part that we see is that sometimes they'll go up with stress. Sometimes they can basically mean, no, it's not a big deal. And so again, it's something that can be really tricky to look at. There are different types of white blood cells too, and they tell us different pieces of information. So that's why, again, it can get really tricky to interpret these as well, because there's so many different reasons that a white blood cell count can be up, and it depends on which ones are up as well. So neutrophils, probably one of the most common ones that we look at. Those usually we see with acute inflammation or infection, or something that would cause that in the body. And I'll give the other example of eosinophils. Those are my favorite, but sometimes we'll see those increase with parasites or allergic disease. And so again, it's not just as simple as looking at just the white blood cell count. The other thing I wanted to point out with the white blood cells is that doesn't mean you get antibiotics if your white blood cell count is up. Because again, there's so many different kinds of white blood cells. There's so many reasons why. And so just because we see that in this dog, actually, I think this is Tilly again, I can see that her lymphocytes and her monocytes are up a little bit. That would not be an indication to me to start antibiotics. So that requires some further investigation. And so it's again just an interesting thing, and it's not always easy to interpret all of this. Platelets, the last one, it's at the very, very bottom there, and those are pieces in your blood that help clot your blood. So we really, really need those. Though sometimes they can be increased or decreased as well. And the question is why? And sometimes it's because they like to clot, they like to clump. So we'll see that sometimes. And that can be a tricky thing to piece out too, is determining, oh gosh, are there platelets, or oh gosh, are they clumping and doing their job? And the machine isn't able to count them all out. So again, a CBC tells us a lot of information, and it's just a piece of the information that we often look at. Okay, chemistry. Sometimes you'll just see it called a chem. Same blood, you can get it from the same blood draw. It just goes in a different tube. And usually a chemistry and a senior dog, usually they're more extensive. So we're getting more values. Sometimes with just a pre-anesthetic panel or young dog panel, we'll see just a few. I call it, again, the highlights. Usually a senior dog screen is more complete. And sometimes we need that even if your dog is younger. I usually run bigger panels on my kiddos. Yes, I get a discount on that, so it's easier for me to do, but I do like having all of that information. And especially as my dogs have gotten older, I've seen more and more changes that I wouldn't have found otherwise. So what does the chemistry look at? Probably the biggest things that we look at are organs. And so the liver has enzymes or values or numbers that we look at. That's what's in red over here. This is definitely Tilly, and these are some increased liver enzymes or liver values. Again, what does that mean? Oh my gosh, so many different things it can mean. Means we need more information. Kidney enzymes or kidney values or kidney numbers. Again, those all kind of mean the same things when we talk about it. I sometimes get that question too, but basically, I'm looking to see is the kidney functioning the way that it needs to be, and there can be a lot of different reasons that the kidney enzymes go up or down too. But that's a clue. If the kidney enzymes are up, maybe there's something going on there, needs further investigation. Blood sugar, very important in our senior pets. Again, blood sugar can be high or low. We usually don't see dogs with low blood sugar that haven't been eating. I think we get that question a lot. Oh, their blood sugar is low and that's because they haven't been eating. We don't always see that. Actually, in really sick dogs, sometimes the blood sugar can actually be high, and that's also a factor of stress, but that's a great value that we look at. That's glucose on the very top there. Um, Protein levels, um, important for lots of different things. And that's something that we look at to see, gosh, is the liver okay? Gosh, is the gut okay? Again, the other hard part about this is that there are so many different things that can cause one value to be high or low. So let's take albumin, for example. It's made in the liver. You can lose it through your gut or your kidneys. And so when it starts to get low, oh my gosh, what is going on there? I need more information because it could be missing, or it could be from three different things, three different other organs. Is there any other information I can gather here? Or again, do I need more testing? Cholesterol, something that we do look at, cholesterol and triglycerides in animals, less commonly because normally their diet is not quite the same, but some dogs are more prone to it, some breeds. So like schnauzers, that's something that I pay attention to. Calcium, again, calcium's a tricky one. It's very, very important in the body, as we know, but it can change for a lot of different reasons. So it can be from bone, it can be from protein, it can be from a parathyroid, your gland in your neck, and sometimes we can see it for cancer. So it's not as simple as we want it to be. I do like looking at electrolytes because that kind of just, again, gives me a good screen. Gosh, are we losing too much? Are we too high? Might we be, more in the dehydrated state? Lots of different things we can learn from that too. One thing I wanted to point out is that failure versus disease. So sometimes we can say an animal is in liver failure. And there are values on here that I look at and say, oh gosh, is the liver failing? Maybe this is liver failure. Sometimes the liver enzymes or liver disease, we know that there's a change there, but it doesn't necessarily mean that your organ is failing. So again, I don't look at my dog's values and go, oh my gosh, she's in liver failure. The only thing I really know is that something's up with her liver. Oh my gosh, I guess I have to figure out what. Same thing, I think we're moving away from kidney failure to kidney disease, and there are stages of kidney disease. But saying kidney failure is a hard one because, gosh, that means you have two kidneys, both kidneys are not working, and we're seeing some pretty dramatic changes in blood work at that point. A lot of animals have kidney disease for a very long time and aren't in actual failure. So those words, I kind of tread lightly there. My dog keeps barking and it keeps scaring me. Um, just one thing about getting blood, that can be really stressful, I think, for owners and for veterinary teams. I think we are getting better about some of the low stress handling or the fear-free movement, different, trying to figure out what works best. Usually, if I can use food, I will. But it really depends on your dog. Most of them do fine. I'm very, very cautious about how I work with them. It's anxiety producing. They're arthritic, so sometimes it's just the way an animal is pulled, and it can be an uncomfortable thing. So I think I really pay attention to those things, and hopefully your veterinary teams are doing the same. We do sometimes use, mild anti-anxieties or things like that to make it more comfortable for animals, but usually it's a pretty simple thing to get. We're either getting it from the neck or the legs, either the front legs or the back legs. And it's just something that I think, again, sometimes I think owners get get worried about. I certainly do too. If an animal is very stressed, I will stop and say, this isn't going to help anything. Let's figure out a different method, or let's try again in a different way or different day. So just something to know that we definitely are paying attention to those things more and more. I'm thankful for that in the veterinary world these days, that it does matter how an animal feels. I don't like getting my blood drawn, so I can understand why they don't sometimes, but a lot of them don't even notice, especially with food. So a lot of times I'll use that if I can. So a UA, or a urinalysis. So that's when we collect some pee. And this can tell us so much information. And again, I think it's really important a lot of times when we're talking about senior lab work, the urine is included in that. And I think you get so much information from this. Very, very important to pay attention to. Probably one of the biggest things I look at is the urine concentration, or the USG. And that is great to know that information for so many different reasons, but especially when I have blood work changes and I look at the urine, I can also kind of gather, oh gosh, are those kidney enzymes up because this dog might have kidney disease? Or gosh, is this dog actually maybe a little dehydrated? Because that's another reason the kidney enzymes can go up. Um, Less common, but it can happen. And so having a urine sample at the same time that you get blood is really, really, really helpful for us. Um, Another thing we're looking at are the cells in there. So red blood cells, white blood cells. Sometimes we'll see abnormal cells that shouldn't be there, that can indicate, oh gosh, is there some cancerous process or something like that starting? Bacteria. So a UTI, or bacteria in the urine, is something we're always looking at as well. This is getting trickier because we now know, we used to say, oh, the bladder is super sterile, there's no bacteria there. We now know that, some bacteria might actually be a normal, what we call the microbiome, or the flora. It can potentially be a normal thing, or not an issue. And that's, again, it's a hard thing to piece that out sometimes. Other things I look at, gosh, if I have an animal that has a high blood sugar, I look to see if they've got sugar in their urine. In dogs, that is most often indicating diabetes. In cats, that gets tricky because some cats get so stressed out, their blood sugar goes through the roof, and they'll even have so much blood sugar that they'll pee it out, and we'll see sugar in the urine. Again, very, very hard thing to piece out. Is this animal diabetic, or is this animal just so stressed? And so, again, things that we're looking at, and we're looking at different changes with the blood and the urine together. Uh, and I wanted to make a point about how we collect urine too. So a free catch is probably sometimes the easiest, I guess, in terms of not having to stress an animal. We take them outside, they go potty, we collect it. Sometimes we miss, and that's a bummer, but that's probably the easiest way. A cystocentesis is probably one of the most common ways we collect it. We call it a cysto, and that is usually using an ultrasound and sticking a needle in through the belly into the bladder. It sounds very scary. And so I think I do talk to owners about this, because I've been in that situation where I've been like, oh no, I don't want, my cat's too crazy. Like I don't want you to do that kind of thing. Um, but it's a very, very safe way to collect a urine sample. Yes, there can be some complications, very, very uncommon and rare. So we do this on a very routine basis, but that's the best way to get a sterile sample. And we want to do that because we need to know, is there bacteria in the bladder, or is there bacteria because your dog peed and it went through hair and the urethra, and then we try to collect a sample and it's dirty? There can be a lot of reasons for that. And so sometimes we need that to know for sure whether or not this is, truly an issue. This is my dog's urine. This is Dollar, the lab that we currently have. And you can see he's got some changes. His protein is high, but 2 plus. That's not normal. But I know why, because I look and, oh gosh, he's got a bunch of white blood cells. There should be 0 to 3 in there, and there's 21 to 50. That's a lot. The other thing that I see, oh my gosh, she's got bacteria. I go down there, there's rods. Oh my goodness. So many rods. What does this mean? It means that there is potentially a urinary tract infection. Um, Dollar is not clinical. He doesn't notice. He's never acted different. I've worked this up with the internal medicine specialist for a long time, and we can't figure out why he gets recurrent UTIs. Sometimes we'll look for stones or cancer or things like that. Can't find anything, and it doesn't go away with antibiotics. It's got a really weird kind of bacteria. So I just throw that out there as like, oh my gosh, what to do with Dollar? But he didn't even have any signs. So um, in this slide, I do hear this a lot too. My dog has a UTI because they're having accidents in the house. And again, we always hope it's that simple. But there can be so many other things that cause that. And so that's again why sometimes I think we hear, oh gosh, we just want to do a urine sample and start there. Well, having that blood work at the same time can really, really help us because a UTI can look like so many different things. Um, just a few other common things that we see that the thyroid in dogs, we know that a lot of senior dogs can develop thyroid issues. That's usually weight gain, lethargy, poor hair coat. But we also know it can be overdiagnosed. And so that can be a hard thing to piece out as well. That's most often included in a senior blood panel for dogs, and especially for cats too. Cats get hyperthyroid, it gets really high. Dogs get hypothyroid. On the bottom here is Tilly's results. She has been low for a long time. And what does that mean? Well, that means I had to do additional testing. She is hypothyroid in a sense. So now she's being treated and now her test is actually high. So that's the one on the bottom where the T4 is high. Not the right test we should have run, but we know that her supplementation is definitely working. Heartworm testing is obviously a common thing, and fecals are obviously a common thing in all dogs. But again, I mentioned that heart marker, this pro-BNP, or sometimes we'll see it the NT-proBNP. It's blood and it's a marker for possible heart disease. Doesn't mean they have it. And so again, usually need more information there. The other thing that we often will recommend or check, or sometimes when we know that there's a cause, is blood pressure. So animals don't get primary hypertension as commonly as humans do. We don't have the same types of heart disease, so that atherosclerosis, not as common. So oftentimes we're seeing it with kidney disease, adrenal disease, but sometimes we check blood pressure and it's high, and then we say, oh gosh, why is this happening? And so I see if this video works. It's pretty short. Let's see. Oh, maybe. So So this is me getting a blood pressure on Tilly, where we can't figure out exactly what's wrong. This is a Doppler, and I was doing it by myself, which is sometimes very, very challenging. And I don't know if you've ever had your blood pressure done, you're like, oh, that's uncomfortable. A lot of animals, very, very stressful for them or uncomfortable. And they're like, what is going on? So it can be hard to get an accurate blood pressure in an animal. Oftentimes we need multiple times of testing. A few things about this. So Tilly is hypertensive. Her systolic blood pressure is 160. So that's high. I've been getting her blood pressures 160 to 180. So she definitely is hypertensive. Again, we don't have an easy answer why, but she's on medication. The other thing is that I don't know, this will apply more in our next lecture, but you can hear that she has an arrhythmia. It's not a normal pulse where it's normally very consistent. She does two and then she has a pause. She does two and then she has a pause. And that's a whole other conversation, but it's nice to be able to hear it. And I think it demonstrates something. So this really gets to the bottom of what does this all mean? Um, well, it really depends. And that's the crummy answer from a lot of veterinarians that I'm sure you've heard. It depends on whether it's in the values increased or decreased, and by how much that value is increased or decreased. Variability. I put greyhounds on here because these are my older greyhounds. They're all gone now, but their lab values are crazy different compared to another animal, another dog. And so knowing those things sometimes is not a common thing to know, but yeah, we can see that. We can see it with age. Puppies, their blood work values might be completely different than the reference ranges for an older senior. So it's kind of like a puzzle. And a lot of this info, may or may not be things that are an issue, but at least we can talk about options. And I think that's where this is so important. Do you want to have options for your pet? Again, going back to those questions, if it was a diet change, would you want to do that if we found something? Would you give a medication every day? What options are out there? Do you want to go to the specialist, or do you want to say, yeah, my dog's 15 and I'm just gonna really make sure that they're comfortable? So it's all kind of very dependent on all of these things, but I do feel like a lot of times sometimes we say, gosh, the next step would be we need some more info. We need to do some other tests. So a few more things and then I'm almost done, I promise. The important thing that I love about blood work and checking annually, and even potentially more frequently in seniors or if there's an issue, are trends. So this is Tilly. She hates Halloween. I love Halloween, and I am that person that tortures my dog and dresses her up every year. This was last year, so we'll see what happens this year. But these are on the left side, these are her liver enzymes, liver values, two of them. And I was like, oh, great, great. And then around kind of midway between 2019, 2022, we're missing some blood work values there. But they start to go up. And it's like, oh gosh, something that's different for her. It turns out she does have some changes in her liver. And so I know that now because of an ultrasound and she's had some other tests done. But it was at least clue to me, oh my gosh, something's there. Same thing on the right side. This is her red blood cell count. So she's always kind of been between 50 and 60, which is kind of a normal red blood cell count for a dog or normal hematocrit. Gosh, she took a really sharp turn in 2019. Holy cow. Gosh, she actually became anemic in 2019. What is going on there? Again, I kind of know what was going on. She actually had a splenic mass and we had to go in and remove it. But gosh, I wouldn't have known where she sat. And then she's been anemic ever since, or her red blood cell count's been much lower ever since. And again, something we're trying to figure out. We don't have answers completely, but I think this is one of the first clues for me that I was like, oh gosh, what's going on? Same thing. This is Mr. Quinn. Oh, he was such a good boy. Greyhounds, again, very weird lab changes. Usually their red blood cell count is really, really high. So if you look two down, I usually again look at the hematocrit, but his red blood cell count was 55. That was actually low for him, 54.8. And then all of a sudden it dropped pretty substantially between this is the same year, August 2020 to December 2020, dropped pretty substantially to where he's anemic. That's really weird for a greyhound. He was normally sitting around 60 for the majority of his life. The other thing, greyhounds usually have an elevated creatinine, which is in the chemistry, it's 3 down. And that can be really common to see in greyhounds. And he'd always had a mildly elevated creatinine. And like, oh, that's normal. That's great. Gosh, it actually went up. His normal creatinine was like 1.8, 1.9. That's where it kind of sat. This is the August blood work clued me off. Huh, that's weird. It's gone up a little bit. And I rechecked it in December. Oh gosh, actually his creatinine and BUN, which are both kidney enzymes, have gone up now. So Quinn actually did develop kidney disease, and that's something that progressed pretty quickly. But you can see even just in a couple of months. And if I didn't know in August, I would have looked and said, like, maybe his blood work's pretty normal, like the creatinine, oh, that could be a greyhound thing. Well, I know my dog and I know his trends. And so this is something that really helped me figure it out. So again, what do we do if we find something abnormal on senior blood work or senior screening? It totally depends. Everything we talked about from the previous slide, the severity on you and your family, on you and your dog, quality of life. What will they tolerate? What steps do you want to take? What steps are options to take? And so that really goes back to the spectrum of care. I like this chart as well because it kind of talks about, gosh, as things progress, sometimes our options become more and more limited or more and more extensive and hard to treat for a higher cost sometimes. And so I think again we're trying to figure out, is there somewhere where we can start to screen things maybe and maybe find things earlier so we can talk about it. That's not always the case. A dog could have everything could be normal, and then again a month later a dog could be really really sick. But are there some things that we can look at? So it's a really tough situation, but I think going back to quality of life in your senior dog is always the most important thing that we can do. The other thing I want to just caution about is, oh my goodness, this is Tilly Terrier's blood work on the left. And I go, oh my gosh, it's all wrong. Everything is in red. That's bad. Oh my goodness, she's dying. Um, I don't know if you heard, I don't know if you could hear because my headphones are in, but in her barking, she's very much alive. Uh, so the interpretation part is so important. And that's where the puzzle pieces come in. And that's where your veterinarian looking at blood work and interpreting those things together and hopefully having good conversations with you comes in as well. Because there are things on here that I'm worried about, but a lot of this is information that I already knew or that I don't necessarily I don't want to say I don't pay attention to it, but I kind of piece out what I need to know. And so I think that I've done this before with my own, results that have come in through my doctor and they haven't looked at it yet. And then you go down the Google rabbit hole and um, all of that. So that's something I just want to caution against is definitely having that interpretation piece and looking at those pieces together is very, very important. And that's something that I can't stress enough. And that's why, it can be really challenging. And it took us, I think, a very long time to figure out some of these things in veterinary medicine and putting these pieces together. And sometimes, again, we say we need more information, but it does depend on those conversations between you and your vet. I just want to go back to Quinn really quick with trends. I only showed you his blood work, but I did urine at the same time, and I can tell where his urine became very dilute all of a sudden. Not necessarily noticing it while he was with us. I didn't notice as an owner anything was changing. I just noticed, oh gosh, his urine's very dilute too. So taking those pieces, putting it all together, and interpreting is important. Um, we will talk about imaging next time. This is part two. So a lot of the imaging I think is really, really cool. And that's sometimes a piece that comes together with lab work. A lot of times if you have liver or kidney changes on your blood work, we might say, gosh, an ultrasound might be a good idea. Or gosh, maybe we need to take some x-rays of your dog's chest before this big surgery because, oh gosh, you're going to, spend thousands of dollars to do this to your dog. What if they have metastasis or spread of cancer to their chest? So all of these things are things what we're gonna talk about, and I know people were probably very interested in a lot of the age tests and the genetic screenings that are coming out and dog DNA tests. I learned so much because I have had so many cases where I've been like, oh, that doesn't fit at all. That's so silly. And so there's actually so much more to this. The other thing that we'll talk about is if your vet hears a murmur, doing an echocardiogram or an ultrasound of the heart, is that even worth it, or do we just watch it? And I have there's a really cool study that has been done showing that we can keep dogs out of heart failure longer if we know what type of heart disease they have and maybe putting them on some medication. And so, those are very, very exciting things for me and hopefully for you guys for next time. The cancer blood work situation, I'll just bring that up really quick. Routine blood work screening, again, usually we don't see anything. We can just say, gosh, something is wrong here. Your dog's anemic. Why are they anemic? Well, there's a million causes. What do we need to do next? Um, there is a new cancer screening called the liquid biopsy that's coming out um, that screens for certain cancers. The overall rate of picking them up sooner than we might on a different test is about 50%. So again, we'll talk about that more. Some people love it. Some oncologists are using it, some aren't. And so again, lots of different options there. So these are just some great resources that I love, and some of the stuff that I looked into. Again, veterinary partner I usually find very, very helpful for a lot of pretty much any condition you can think about. Obviously, gray muzzle, we try to do these things so that hopefully you find you're getting some good information. And then again, I'll always encourage you to go back to your vet and just talk through these things. So um, yeah, with that, I
Wow,
think,
Ashley, thank you
oh
so
yeah.
much. No, this is
Thank you.
so
I was like, oh my gosh, we're there. We made it.
we have
So,
one question, actually.
okay.
Tracy, what are the risks of long-term use of carprofen? My dog is 15 and
Mhm.
arthritic and has been on this drug for 2+ years.
Yeah, that's a great question. Um, And that's a hard one to answer sometimes. Carprofen is an anti-inflammatory, and we know that it can be hard on your organs, particularly the liver and the kidneys. Sometimes the liver disease that we see with carprofen is actually what we call an idiosyncratic reaction. We usually see that after a short time of carprofen, not usually if they've been on it for an extended period of time, but the liver is basically your detoxifying organ. And sometimes we don't know why. In certain animals, it gets very angry and can make an animal really, really sick from this idiosyncratic reaction. We don't know why that happens. Um, Kidney disease more common, uh, and it's not something that certainly it can exacerbate kidney disease, and it can cause it at inappropriate doses and things like that. It can be really, really hard on the kidneys. That being said, becomes a an issue of, gosh, as your dog's getting older, things start to degenerate, and so is the medication causing that? Or is it something that was going to happen anyways? And the thing that I think is helpful with carprofen, or why we sometimes recommend, sometimes it's twice a year blood work for that, is just making sure we're having those conversations with owners about the cost benefit. If your dog is comfortable on carprofen, is developing some kidney disease slowly over time, we kind of weigh that. Some owners would say, I want to stop that drug and I want to do something else. But I think it comes down to quality of life. So it's hard to say if the medication is truly the cause of these changes in aging pets, or if it's something that was going to happen anyways, and carprofen is just harder on the organs. That being said, I feel like it's the anti-inflammatories sometimes are wonderful, wonderful medications for senior dogs as they age, and especially with arthritis. Sometimes we recommend trying to get down to the what we call the lowest effective dose. So the dose where you feel like your pet is comfortable and doing well, and maybe it's not the fully prescribed dose. So that's something also to talk to your vet about. Um, Lucille, one of the labs that we adopted her when she was maybe 8. She's got horrific uh, hip dysplasia. She was on it the entire 3 years we had her. That was not what eventually took her, but I wasn't going to ever take her off of it because I felt like her quality of life was so much better while she was on it. So it's just something to be aware of. The other thing I guess I would say is sometimes GI, like ulceration or upset, especially again as a dog is aging, things are just not working as well. And so the question becomes, is it truly the medication causing it, or is it potentially these things coming together as your dog's aging and things aren't working as well? So I hope that answered your question.
Yes, thank you very much. That was great. Are there any other
Yes.
questions? I know there's been some folks who are asking which slides you can share. So we thought maybe after this you can go through them and see if there's something that can be shared and we can
Oh,
send it out.
yeah, yeah, for sure. It took me a long time to figure out how to do this, but there are smarter people than I behind Gray Muzzle, so we will figure it out for sure. And again, I hope that you'll join me for talk two. As things get closer, we'll make sure that we get that announced and stuff. We don't have a date set yet, though.
Yay. Well, thank you so much. It was
Yay!
a wonderful talk and I hope everybody
Thank
enjoyed it.
you.
So thank you all for joining us.
Yes, thank you so much. Give your senior dogs kisses. Uh, all your animals, actually, even your puppies and your kitties. So, thank you, and we'll see you soon. Take care.